Good morning, we are here with Elton Afari from Cosmopolitan Insurance and Edward Gay, our country representative in Ghana. So we are very happy to introduce Elton to our hospital, and we are very happy for the collaboration between Cosmopolitan and KCM Clinic. So Cosmopolitan Health Insurance will be the first insurance in Ghana to cover medical treatment abroad in Europe. We are looking forward to it. Elton, how is it so far to be in Poland? How do you like KCM Clinic? What do you think about this collaboration?
I think that I'm excited to be here. It's a beautiful country, beautiful weather, and beautiful people here. It's one of the major things that I was looking up to, because this partnership is just going to bring our clients and prospective clients in Ghana to Poland to be able to have what we call medical tourism.
Yes.
When they are nowhere, and if the ambience is not nice, if the people are not nice, it will be difficult. And I find it very exciting that I have all these in here. So I'm hopeful that my people or my clients will come into Poland and have the best of healthcare and the best of treatment in here. So I'm excited.
Elton and Edward, we will see the operation theater right now. So KCM works on 2 operation theaters with 50 beds downstairs on the operation. Yeah. So in one time there can be both different surgeries done. So for example, on one part the gynecology surgeries, on the second part the orthopedic surgeries. Okay. Today, since we have Wednesday, there is only orthopedic surgeries done, arthroscopy exactly. So we will see to join it right now. Come on, gentlemen. All of the footage is on the endoscope, yes? So it's an endoscopic procedure, so the doctor is not looking in the knee directly, he's looking on the screen and fixing in while looking at the screen. So at KCM we do around 100 procedures weekly here, all combined, yes? So orthopedic, neurosurgery, gynecology, laparoscopic, bariatric surgeries and plastic surgeries. So as I told you before, we work on both of these operation theaters here. And but for now there was no need to open both ones. The orthopedic doctor which is performing the surgery, Dr. David Skiba, he's very experienced in knee surgeries mostly. Usually, if you have some orthopedic doctor in Ghana, he will cover all of the orthopedic fields. Here we have such a specialized doctor that one of them is covering knees, one of them is covering hips, one of them is covering arthroscopies, ACLs repair, one of them is for replacement. So each of the orthopedic doctor has his own specialization. As you see, there's a very small amount of blood, it's just because of the incision. And next day, so already today in the evening the patient will be able to walk out and he will just come for a checkup next day. And with orthopedic surgeries, the rehabilitation starts straight. So already in the waking up room, in the hospital room, the rehabilitant will come to the patient, show what is the rehabilitation about, what the patient should do in the first days. Especially the first 2 weeks are pretty important to move the knee correctly. And after the other surgeries like hip replacement, knee replacement, also the rehabilitation starts straight in the hospital room and goes for at least 10 days. So this is also the time that we will want our Ghanaian patients to come to Poland after this for these surgeries, because the rehabilitation is a very important part. Yes. So, and in this 10 days of rehabilitation, the patient will be able to get to learn what exercise should he do by himself after going back home to Ghana. After neurosurgery is, for example, different, because there the rehabilitation cannot start straight after the operation. The first moment when it can start is 2 or 3 weeks after surgery. So for this scenario, mostly our patients are going back home 5 days after surgery, and then our rehabilitation is connecting with their physiotherapist and showing what rehabilitation should be done. This is Elton Afari from Cosmopolitan Insurance Company. This will be the first insurance company to introduce in Ghana treatment abroad. So health insurance covering treatment abroad. For example, exactly orthopedic surgeries also. Yes. So can you tell us what kind of orthopedic surgery have you done right now?
No, arthroscopy of me.
Okay, and was it a normal regular arthroscopy or?
Yes.
It was regular. Okay, and how it went?
Very good.
So this is the heart of the operating theater. It's the operational tower. So we only use Olympus equipment here, which is committed as state-of-the-art equipment for operating theaters. So this is for laparoscopic operation, for endoscopic operation, so for all the minimal invasive approaches which we are doing. Operating beds, they are up to 250 kilograms, so even the biggest patient that we had here from Gabon, he could also easily fit on the bed and we could operate on him. So all the surgeries that we are doing, the doctor will not actually, it's not like the previous operations which are still happening in Africa, which are open operations. The doctor are doing very small incisions, very small approaches, and they actually look what they are doing at the screen. Yeah, so there is no need to do a big cut on a patient. Only a small incision. The camera is going in, and everything what is done, the doctor is just looking at the screen, which is actually giving him a way better accuracy. So he will see much better on the screen what is happening there than if he would have to open the patient and look inside. And the biggest advantage of this is the blood loss. So there is no blood at all because of the small incision. In all the big surgeries that's been done years and years before and now still done in Africa, there is this big cut which is causing a big blood loss, which is causing the patient to stay in the hospital for 1 week, 2 weeks, yes, because the patient is weak. After minimal invasive surgeries, the patient is going out of the hospital after 1 or 2 days. So it's a game changer, yes, which we also with Cosmopolitan want to sooner introduce to Africa. So a lot of patients from Africa are struggling with some pain that they cannot diagnose it in country, so this can also be done here at KCM.
We have our own private drivers that pick you up from the airport, comprehensive pre-assessment before the surgery, all the consultations, personal driver, hotel accommodation, everything in one package. Medical trouble made easy. This is the actual KCM Clinic car we are sitting in right now with the driver. He will pick you up from the airport, Wrocław or Prague, and drive you directly to the hotel in case you arrive in the evening hours. Or if you arrive during the day, he will drive you directly to the hospital to start your pre-diagnostic test. The drive takes around 60 minutes. Upon your arrival, you will be greeted by your personal assistant at the hospital reception desk, right here.
Hi, I'm Magda, I'm your personal assistant. Hi, nice to meet you.
Part of your comprehensive pre-surgery diagnostic package will be to have an X-ray, as we see here in the example. Furthermore, you will have morphology, cardiological tests, which I will show you later.
I'm excited about what I've seen, and I think that our clients in Ghana and even elsewhere will be happy to come evacuated from Accra or from the Ghana or the Eastern regions to come to KCM in Poland,
Yes.
to be able to have the service and healthcare that they need. I've seen the place and I've seen what they do. I've seen the surgeries, and I think that we're going to provide Cosmopolitan Health Insurance clients with the best of healthcare tourism in Poland and with KCM. I'm so excited.
We are also very excited. We know that Ghanaian patients will be treated well here.
Yes, I think that this partnership is going to be for years to come,
Yes.
and it's going to help our clients who need these services. I know that some services are being done in Ghana though, but I think that we are going to get the best of service in KCM in Poland and in Europe. Thank you.
Thank you very much, Elton.
Thank you.
Thank you.